Yeah.
Which is nice.
I know. Hey guys, I'm Ryan Clairmont. Welcome to Backcountry Medicine on Train to Hunt. This is my buddy Dan Reynolds. He is a guy that I met when I was in the Army. He's a family practice doctor, and him and I were in Iraq together, and when we were up here stationed, we did a lot of hunting, and now we're both out of the Army and we went to work for the same company. So we both enjoy the outdoors, we both enjoy working out, staying fit, but I'll let Dan take over and tell us a little bit about himself.
Daniel Reynolds, and Train to Hunt is something new in my life as well. I learned about it through Ryan Clairmont, a good friend over here. Like he said, we were in Iraq together and stationed up in Alaska for 4 years together. He's taken me out hunting many times, and we look forward to hunting a lot more up here. But to do that, you got to be in good physical condition. Today we're going to be talking more about what's going on with health in general, and focus today on cardiovascular health, or your heart health.
Yeah, so we want to talk a little bit about, I know Dan and Kenton really hit a lot on training and nutrition and that sort of thing, but I think one thing that we'll be able to add to the site is a little bit of medical background and some topics that we can hopefully help out all the Train to Hunt members think consciously about their health on the inside, as well as the fitness and nutrition that Dan and Kenton offer you guys. So for today we're going to talk about heart health. And to start, we'll talk a little bit about cardiovascular risk factors. You may have heard that term before. You may have relatives of yours that have had heart problems or cardiovascular problems in the past. But we'll just talk a little bit about some of those risk factors. So Dan, what are some of those risk factors?
So there's going to be different things that you want to be aware of in your own life, and those will tell you how many, what your percentage of having, what your chance of having a heart attack is in the next 10 years. There's really good online calculators out there. One of them is the Framingham Risk Calculator, if you want to look it up. And you can just plug in the numbers that you get, that they ask for, and then it'll give you your risk of having a heart attack in the next 10 years. And those risks specifically that they get into are going to be what your age is. If you have a family member that's had a heart attack at a young age, now a young age is considered less than 55 for women and less than 65 for women, and then less than 55 for men. So if your mom or your dad has had a heart attack at those ages, then that would increase your risk. Other risks include your tobacco use, your blood pressure, your cholesterol level, if you have diabetes, and of course if you've ever had a heart attack before.
So when you talk about, let's talk about, you talked a little bit about age. You said 65 or younger than 65 for a woman, or younger than 55 for a man. Speaking of probably your father or your mother, what about,
correct,
grandmothers or cousins or uncles? Does it go there too, or does it?
Right, so the majority of studies that have been done have linked it to mom and dad, and lately they haven't really tied it in with grandparents and aunts and uncles as of yet.
Yeah.
But obviously, there's genetic components to this, to heart attacks, as well. So if you've got a bunch of aunts and uncles and cousins that are having heart attacks, logically you would think that that's going to do it, but the studies have not been done to show that. It's a first-degree relatives, so mom, dads, brothers, sisters.
Gotcha. So let's talk about blood pressure. I know a lot of the studies and the standard for hypertension or high blood pressure is 140 over 90. 140 systolic, that's the top number on your blood pressure, and then 90 diastolic, which is the bottom number on your blood pressure, that is diagnostic of hypertension or high blood pressure. Now, that varies as well depending on what your risk factors are, correct?
Right.
So like if you have other cardiac risk factors being you are older than 65 for a woman, older than 55 for a man, you may want that blood pressure to be even lower than that. If you use tobacco, whether it's smoking or smokeless tobacco, that number will want to be lower than 140 over 90.
Right.
What are some other things that would cause that number to be lower than 140 over 90?
Right, so if you've got diabetes, then you're at increased risk for kidney disease. So to protect your kidneys and your heart, other things you'd want to get that number below 125.
125.
The top number, yeah. So it gets, in situations like that, you're going to want to get in and talk to your doctor. If you speak with a hypertension specialist, they would probably recommend that everybody get their blood pressure down below 125, even, heart healthy, no other problem type people. So
according to the literature out there, what's perfect blood pressure?
Perfect blood pressures?
What's a goal blood pressure?
For everybody out there, you would want your blood pressure your systolic below 130. But again, if you have these special conditions, below 125. And your diastolic then is going to be down 85 or lower.
Okay. All right, so that's good to know. If you didn't already know where your blood pressure is at or where it should be, that's a good thing to get checked out for sure, especially before you start any high intensity training regimen or before you head out into the woods and decide you're going to go climb that mountain. Most people, if you're on this site, you're probably a pretty healthy individual, or you're looking to get healthier or become healthy. So that's something good, and I really feel that everybody should know what their blood pressure is.
Absolutely.
You should know, just like you know how old you are, you should be able to somebody should be able to ask you at any given time, what's your blood pressure? And you should know pretty much what your blood pressure is all the time. So if you don't know what your blood pressure is, you should go get that checked out and just find out what your blood pressure is right now. And that basically gives you a baseline of where you are today.
Yeah, and one of the great things now is that you can get a blood pressure monitor, home blood pressure monitor, for pretty cheap. So you can just measure it at your home. Usually that's going to be a lot more accurate than the one you get in the doctor's office, unless the staff in that office have been trained really well, because certain things you need to do to get the accurate reading, you need to be sitting in a chair for 5 minutes in a quiet room before you get your blood pressure checked. And oftentimes, when you go into the doctor, what will happen is they'll stand you up, walk you in, sit you down, and check your blood pressure right then. Well, you've just increased the output of your heart by standing up and walking, sitting down. And so your blood pressure is always going to be higher. So you need to have that time to rest. There's also white coat hypertension. People get a little bit more anxious when they go in to see the doctor maybe, and they're getting their blood pressure checked. Other things that they do before that, they're drinking their coffee on the way to the doctor's office. They're doing other things, putting
that cigarette out.
Putting the cigarette out, exactly. I was going to say that. So those are all going to raise your blood pressure. So that's not going to give you a true accurate reading of what your baseline blood pressure is.
Yeah.
Other factors that raise your blood pressure, or that can help you control your blood pressure. A pound of fat has about a mile of blood vessels, capillaries and everything in it. So if you think about that, if you're a little bit heavier than you used to be, your heart has to pound that much harder to get blood to that tissue. So if you decrease the amount of weight that you have, you're going to decrease the amount of work that your heart has to do as far as your blood pressure is concerned, and that will preserve all the other vessels because they don't have to see as much pressure. It's a closed system.
Say that again. A pound of fat has a mile?
About a mile of blood
vessels. So your heart has to work that much harder. That's amazing. I've never heard that before. That's pretty incredible. No wonder obesity has put so much stress on your heart.
Yeah.
And why obesity, right now, I think it's the number 2 killer, preventable cause of death. Is it not? It's closing the gap on number 1. I'm pretty sure. I think tobacco, smoking is still the number 1 cause of preventable death in the country.
Right, linked to it.
Right, and obesity is catching that every single year.
Yeah.
So, yeah, I mean, staying healthy, staying fit plays such a critical role in your health. And I'd never heard that before. That's a pretty phenomenal statistic there. So why should people care about their blood pressure though? What does it do to the heart? So somebody who has normal blood pressure versus somebody who has high blood pressure, why should they lower their blood pressure?
Okay, so blood pressure is one of the main things that's been linked to heart attacks and strokes. Microvascular damage is what they call it. So microvascular damage is going to be anything that occurs to the small vessels in your body. Eyes, kidneys, the capillary beds down in your fingers, hands, toes, up in your brain. And the reason why lower blood pressure is better is, imagine, if you will, that you have a hose in the closed system, and you turn that, say it's a fire hose, and the outlet of the fire hose is your heart. So right at the beginning you've got the highest amount of pressure, and then as it travels down the hose it's going to decrease in strength, right? So down at the very end, say you get down to a garden hose or a drip line, it's going to be really low pressure because there's so many different outlets for that pressure system. Well, up at the front of that, you're going to be seeing this high pressure, and the more of the little vessels you have further down, like out in your fat, that's going to cause the increased pressure up at your heart. So your heart is going to be seeing a lot more pressure. It's going to be distending those arteries and the heart itself, and what that will do is it will cause damage to the lining of the vessels that are higher up, as well as to the vessels that are farther out. And that damage is stuff that cannot be reversed. So we need to protect that from the get-go. So the earlier you know you've got bad blood pressure, the sooner you can fix it. The better shape you stay in your whole life, the less pressure your heart is going to see throughout your life. And that will protect your arteries from becoming calcified, becoming less, which when they become calcified, they become less distensible.
More rigid, right?
Right, more rigid.
Become calcified, more rigid. They don't expand as easily.
They contract.
Right.
Yeah. So then, if you get an increase in your blood pressure that they can't handle the, distending, just imagine the brittle garden hose, That's exactly what's going to happen with your blood vessels, and they're going to burst.
Yeah.
So if that blood vessel's up in your brain, you get a stroke. If that blood vessel's in your heart, you get a heart attack, If it's your aorta, you get, you can get aneurysms, that are going to burst. So that's why it's critical to keep good control of your blood pressure.
Yeah, that's pretty critical. Not to mention, when you talk about the elasticity of the vessels, as your blood pressure increases, and that increase in blood pressure puts back pressure on the heart. Like you say, it's a closed system. Every time that heart contracts, it's pushing blood out, and that's really where the measurement of the blood pressure comes. It's how much pressure is being exerted on those vessels every time your heart pumps the blood out. If it's a really high pressure, that pressure gets pushed back onto the heart. The heart has to work that much harder every single time it beats. So again, it's very important to have good blood pressure, know what your blood pressure is, and if it's high, get it treated. There's medications out there you can take, but there's also a lot of things that you can do before you jump straight to medicine that can lower your blood pressure. So we'll talk a little bit about that. So one thing is diet. There's a lot of dietary things that you can do to lower your blood pressure.